Are you up all night urinating? Has your stream slowed down? Are you going more often or finding yourself rushing to the bathroom constantly? If any of this sounds familiar, then this podcast is absolutely for you. Welcome back to the Dr. Eva Danial podcast, your trusted source for evidence-based medical and sexual health content. I'm Dr. Eva Danial, a urologist and pelvic surgeon, and today we're diving deep into a condition that affects millions of men worldwide, benign prostatic hyperplasia, or BPH. We're going to cover what it is, why it happens, how you might be able to prevent it, the truth about supplements, and the various treatment options available to help you manage these symptoms effectively. What is BPH? Let's start with the fundamentals. BPH, or benign prostatic hyperplasia, is an enlargement of the prostate gland. The prostate is a walnut-sized gland located just below the bladder, and it surrounds the urethra. That's the tube carrying urine out of your body, or what I like to call the P-tube. BPH occurs when this gland gets bigger. And here's something that might surprise you. It's incredibly common. By the age of 60, about 70% of men have BPH. Let me repeat that for emphasis. By the time you're 60, 7 out of every 10 men will experience BPH. And if you reach 80 years old, that number jumps to 80%. Now, here's something important to understand. Having an enlarged prostate doesn't automatically mean you'll have symptoms. The size of the enlargement doesn't always correlate directly with symptom severity. Sometimes your doctor will examine you and say, "Your prostate isn't that large, but you're experiencing really bothersome symptoms." Conversely, you might have a significant enlargement but minimal symptoms. It's not always a straightforward relationship. Recognizing the symptoms. When symptoms do appear, they're typically related to urination. Here are the common things you might experience. You might notice increased urinary frequency, going to the bathroom more than 8 times a day. Urinary urgency is another common symptom, where you feel a sudden, strong desire to urinate that you can't delay or postpone. Nocturia is particularly bothersome for many men. This is waking up more than once at night to urinate. More than one nighttime interruption is considered abnormal and can significantly impact your sleep quality and overall well-being. You might also experience a weak stream, noticing that your urinary flow isn't as forceful as it was in your younger years. Hesitancy is a difficulty starting urination. You have to wait a moment before the flow begins. Intermittency means your stream stops and starts, which can be frustrating and inconvenient. Many men also report incomplete emptying, feeling like they can't fully empty their bladder, sometimes followed by what we call post-void dribbling, a small amount of urine coming out right after you think you're done. Leakage can occur for 2 different reasons. Sometimes it's because you need to go urgently and can't make it to the bathroom in time. Other times, your bladder becomes so full that you experience overflow incontinence. Your bladder literally can't hold any more urine, so it leaks. These symptoms affect people very differently. Some men aren't particularly bothered, but for others, these symptoms significantly impact their quality of life. Those who wake up multiple times each night to urinate face particular challenges. Not only are they at increased risk for falls on the way to the bathroom, which is genuinely concerning, especially for older men, because falling and requiring hospitalization increases your risk of dying within the next year to about 20%, but you're also not getting quality sleep. You're exhausted, you can't fall back asleep easily, and this really affects your overall quality of life and well-being. It's also important to understand that BPH is not cancer. Having an enlarged prostate doesn't mean you have cancer, and it doesn't increase your risk of developing prostate cancer in the future. Why does BPH occur? Now, let's explore the science behind why BPH happens. Benign prostatic hyperplasia is a complex process involving hormones, genetics, and inflammation working together. Hormones play a significant role, particularly in prostate growth. We know the prostate size is sensitive to something called DHT, which is a byproduct or conversion product of testosterone. Some men with enlarged prostates have higher DHT levels, but not all of them do. And here's where it gets interesting. If BPH were simply caused by testosterone, then we wouldn't expect prostate enlargement to continue with age, since testosterone naturally decreases as men get older. But it does continue growing, which tells us other factors are at play. Inflammation is one of the biggest contributors. Chronic, low-grade inflammation in the prostate actually promotes growth. This inflammation can result from various causes: bacterial or viral prostatitis, hormonal changes that trigger inflammatory responses, autoimmune changes, and alterations in the prostate microbiome. When inflammation occurs, it triggers the release of specific growth factors like epidermal growth factor, insulin-like growth factor, and transforming growth factor beta. These growth factors send signals throughout the prostate tissue, stimulating cell growth and division, a process we call cell proliferation, which leads to prostate enlargement. Think of any organ as maintaining a balance between cells growing and cells dying. Our skin does this constantly, shedding old cells while growing new ones. But in BPH, there's an imbalance. More cells are growing than are dying off, leading to enlargement over time. As the prostate grows, it creates areas with low oxygen levels. These hypoxic areas trigger additional inflammatory substances, creating a vicious cycle. Growth creates inflammation. Low oxygen creates more inflammation, which creates more growth factors, which causes continued enlargement. Genetics also play a role. If you have a close male relative, usually a father, who developed BPH at a young age, before 60, you may be at higher risk. Research shows people with a genetic component are more likely to develop BPH symptoms as early as their 40s, compared to those without this genetic predisposition. Prevention strategies. Now that we understand what factors contribute to BPH, let's discuss prevention. We can't control every risk factor. Genetics and aging are beyond our control, but there are evidence-based steps you can take to reduce your risk. First and foremost, maintain a healthy weight. Studies show that men with a BMI over 35 have more than double the risk of developing BPH compared to men with a BMI under 25. If your waist circumference exceeds 40 inches, your risk increases by about 50%. So maintaining a healthy body weight and reducing body fat is incredibly important for minimizing the inflammation that starts this cascade. Stay active with regular physical activity. Even light exercise significantly helps. Light exercise means just 2 hours of walking per week. That's less than 20 minutes daily. Even 20 minutes of walking each day can reduce your BPH risk by 30%. If you exercise regularly about 6 times weekly, the research shows these men have a 50% lower risk of BPH. Diet plays a significant role too. Limit high-fat red meats. Daily red meat consumption increases BPH risk by about 30% compared to eating it less than once weekly. Eat more vegetables. 4 or more servings daily reduces risk by about 30%. Consider adding lycopene-rich foods. Tomatoes, especially cooked tomatoes, contain lycopene, which research suggests may help prevent BPH. Watermelon is another excellent source. High-fat intake exceeding 38% of your total calorie intake increases BPH risk by 31%. Manage your chronic conditions actively. Keep diabetes, high blood pressure, and high cholesterol under control. This reduces inflammation and benefits not just your heart, but your prostate as well. Be mindful of medications. Some over-the-counter drugs can worsen BPH symptoms. Antihistamines relax the bladder, making it harder to empty. Decongestants like pseudoephedrine tighten smooth muscles, making urination more difficult. Some tricyclic antidepressants can also negatively affect bladder function. If you're taking any of these for allergies or other conditions, talk to your doctor about alternatives if you're experiencing urinary symptoms. The truth about supplements. Everyone always wants to know what they can take over the counter to help improve their symptoms. Let me give you the honest truth based on research. The most studied supplement for BPH is saw palmetto. Early studies looked promising, But more recent, high-quality trials tell a different story. One large study involving over 3,000 men found that saw palmetto showed no real difference compared to placebo in terms of improving urinary symptoms, even at high doses. A placebo is essentially a sugar pill, something you take believing it will help, but it actually doesn't. That said, I still find some patients report benefits from saw palmetto. So if you want to try one supplement, this might be worth considering. Beta-sitosterol has less data supporting it. Some studies show some improvement in urinary symptoms and flow rates, but it lacks long-term research data. Pygeum africanum has been reviewed in what's called a Cochrane review, a very high-quality meta-analysis of all available data. They found some evidence of symptom improvement, but unfortunately all the studies were short-term and of variable quality. Pumpkin seed extract is another interesting option. Some studies show modest benefits in symptom scores, but results aren't consistent. Sometimes you see benefit, sometimes you don't. Stinging nettle isn't usually studied by itself. It's typically combined with saw palmetto, and in those combination studies, researchers have seen some symptom improvement over longer periods, around 96 weeks. Regarding lycopene supplements, I mentioned that dietary lycopene from tomatoes and watermelon shows benefits. However, supplement data on lycopene is less robust. I'd rather you eat your lycopene from food sources than take a supplement. Here's something genuinely important to remember. Supplements vary significantly in quality. One study examined 27 saw palmetto products and found huge variability in active ingredient content. Only 7 of those 27 met proper criteria for a quality saw palmetto supplement. Remember that natural doesn't always mean safe or effective. Botox is natural, you can find it in the environment, but a large dose will kill you. So be thoughtful before taking any supplement. There's very little regulation on supplements, so you can't always be certain what's actually in the bottle matches what the label says. Always mention any supplements to your doctor before starting them, and review the ingredients carefully. You might be taking more of each ingredient than you realize across multiple supplements. Behavioral changes matter. Before you even start supplements, I'd argue that behavioral changes can be just as effective, if not more so. Look at how much you're drinking. If you're drinking enough fluid, your urine should be about a light yellow lemonade color. If you're drinking too little, it's darker. If you're drinking a lot, it's clear like water. Once in a while, clear urine is fine, but if it's always clear, you're definitely overdrinking. Some people think, if I drink less, my symptoms will improve. Actually, the opposite is true. If you drink too little, your urine becomes very concentrated, which irritates your bladder lining and makes symptoms worse. Consider what you're putting in your body. If you're consuming things that irritate your bladder, try eliminating them for just a couple of days. You'll quickly see a difference. You don't need weeks like with digestive issues. Caffeine is a major offender. It's not just coffee and tea, though those are the most common sources. Caffeine is also in chocolate, ice cream, certain Celsius drinks, and many sparkling waters. I see patients drinking 6 cups of coffee daily. Of course, their bladder is irritated. Alcohol is another irritant. People urinate more when drinking alcohol because it's a diuretic, but it also irritates your bladder lining. If you're having a glass of wine at dinner every night, it may contribute to nighttime urination. Other bladder irritants include citrus fruits and juices, tomato-based products, spicy foods for some people, artificial sweeteners, and carbonated beverages. I've created detailed content on bladder irritants on my YouTube channel if you want more information. Specifically regarding dinner, if you're waking up frequently at night, start by examining what you're drinking at dinner. If daytime symptoms are your primary issue, look at what you're drinking throughout the day. Also, limit how much you drink before bedtime. If you're drinking heavily within 2 hours of bed, you'll definitely wake up more often. Constipation makes bladder symptoms significantly worse because stool filling the rectum, located right behind your bladder, pushes against it, making it more sensitive and symptoms much worse. Ensure you're not constipated. Try over-the-counter options like Miralax or natural options like prunes. Even reducing just 8% of your body weight can significantly improve your urinary symptoms. If you're smoking, quit. Smoking is a huge bladder irritant, affecting not just your prostate and bladder, but your lungs and entire body. Medical treatment options. If you've tried conservative management and supplements without adequate improvement, let's discuss medical treatments. I'm focusing on medications today and will do a complete separate episode on surgical options, which have many exciting new treatments I want to give proper attention. The most common medical treatment is alpha blockers, often known as Flomax tamsulosin or alfuzacin. These work by relaxing the prostate and bladder neck muscles, allowing urine to flow more easily. They work quite well, usually taking about a month for full effect, though sometimes they work sooner. However, they do have side effects. With tamsulosin, the most commonly prescribed alpha blocker, there's a very high rate of retrograde ejaculation. This means when you ejaculate, you'll have little to no volume because it goes back into the bladder rather than out. We do have other options like alfuzacin with lower retrograde ejaculation risk. Some people also experience dizziness when standing up too quickly. If you're having any eye surgery, tell your urologist because alpha blockers can cause floppy iris syndrome, making eye surgery more difficult for your ophthalmologist. Another medication class is 5-alpha-reductase inhibitors, finasteride or dutasteride. These block the conversion of testosterone to DHT. Remember, the prostate is very sensitive to DHT, so blocking this conversion shrinks the prostate. These take time to work, sometimes 3 months, but occasionally up to 9 months for full benefit. At lower doses, these medications are also used for hair loss, which might be a nice side effect. However, there are 2 major side effects to know about. A small subset of people experience sexual side effects affecting libido. These can be very bothersome and take a long time to resolve. Additionally, while these medications don't cause prostate cancer, they reduce your PSA, a prostate cancer screening test, by 50%. The data shows that if you get prostate cancer while taking these medications, you're more likely to have a higher grade cancer than if you weren't taking them. It doesn't mean the medication causes cancer, but there is this risk. I suspect this is partly because your PSA is reduced, so when you look at that number, it should be mentally doubled for screening purposes. The last medication many people don't discuss is phosphodiesterase 5 inhibitors, tadalafil, which we use for erectile dysfunction. At low doses, it relaxes smooth muscle and helps with prostatic symptoms. It's actually excellent, particularly if you have both erectile dysfunction and BPH, because one medication addresses both issues. Side effects can include mild, cold-like symptoms, stuffiness, or muscle aches, but at low doses, most people do quite well. You can combine medications, taking both alpha blockers and 5-alpha-reductase inhibitors, most commonly Flomax and finasteride. Solid trials show this combination is even better for large prostates and more severe symptoms. Talk to your doctor about maximizing your medical therapy if you want to avoid surgery. You can use higher doses or multiple medications simultaneously. The excellent news is that we now have many options for BPH, procedures and surgeries that can help you achieve symptom relief. If you're sick of taking medications or prefer not to, surgery is an excellent option to consider. Make sure to subscribe to this podcast on your preferred platform or to my YouTube channel. I'll be doing a deep dive into all surgical options, reviewing the data, explaining exactly what to expect after each procedure, and potentially featuring world experts in newer options who can share their experience. If you found this episode helpful, please share it on social media with friends and colleagues. Everyone deserves access to high-quality, completely free educational content. That's why I do this, to empower people to make accurate, evidence-based decisions for their bodies. The most important takeaway is this: BPH is incredibly common, but it's treatable. Whether you choose conservative management, supplements, behavioral modifications, medications, or surgical interventions, options exist to improve your quality of life. Start with the basics. Maintain a healthy weight, stay active, eat well, manage chronic conditions, and be mindful of what you consume. Many men see significant improvement with these foundational changes alone. Don't suffer in silence, thinking this is just a normal part of aging. Talk to your healthcare provider about your symptoms. There's no shame in experiencing BPH. It's one of the most common conditions affecting men. Your urologist has numerous evidence-based treatment options ready to help restore your quality of life. Whether you're dealing with nighttime urination disrupting your sleep, daytime urgency affecting your work, or declining quality of life, effective treatments exist. The key is taking action, being informed about your options, and choosing the approach that aligns best with your lifestyle and preferences. You deserve to feel your best and get back to living without these bothersome urinary symptoms controlling your days and nights. As always, take care of yourself because you're absolutely worth it.